Cauda equina syndrome is a devastating condition. Usually occurs when a patient has a herniated disc, a tumor, an infection, some kind of condition that causes compression on the lumbar nerve roots in the lower part of the spine, the lumbar spine. So the spinal cord ends at the bottom of the thoracic section of the spine, and around L1, that's lumbar level 1, the spinal cord ends and it becomes what's called the Cauda Equina, which is Latin for the horse's tail. And the reason they call it Cauda Equina is because it looks like the hairs of a horse's tail. It's a bunch of nerve fibers that go down to the different lumbar nerve roots and go through the lower portion of the body, the legs, and some other areas. They send motor signals, sensory signals throughout the lower part of the body. And what happens is when the Cauda equina gets compressed at a specific level, whether it's from a bone fragment from a fracture, a tumor, an infection, a herniated disc, whatever it might be, it can cause an inflammatory process that slowly strangulates the nerves below that level. So if you have a lumbar fracture at L4-5, it compresses the lumbar nerve roots at that level and below. The compression can cut off not only the electrical signals, the nerve signals from the brain to the areas associated with L4-5 and below, but it can also cut off the blood supply to those nerves in that area. Or if it's compressed severely enough and for long enough, that compression can cause permanent damage to those nerves, which means the person will never regain function at those levels. So unfortunately, in a lot of cases of Cauda equina syndrome, patients wind up in a wheelchair or having difficulty with their mobility, difficulty controlling urination and bowel movements, and really a complete destruction of their quality of life. So one of the most important things that can be done when a person begins to have Cauda equina syndrome is to catch it, for your medical provider to catch it before it's too late to reverse course. So early diagnosis is essential, and early treatment, usually in the form of a surgery, either a laminectomy, removal of the infectious process, removal of the tumor or the fracture or the herniated disc, whatever is causing the compression, promptly. There's an old-fashioned rule that is 48 hours, and it is good practice to get to the source of the compression as soon as possible, but there certainly is no magic timer that goes off after 48 hours, which says 48 hours after compression, the patient has no chance of recovery, or 47 hours after compression, the patient's going to be fine. It's more of a sliding scale. The longer those nerves are deprived of their oxygenated blood and their sources of nutrients, the worse the condition is going to get, and the less likely the patient is going to recover. One of the key things that must be done whenever a patient is suspicious for Cauda equina syndrome is a full neurological examination. So that means examination for saddle anesthesia, a thorough review of all the symptoms that the patient has. And a lot of times the patient won't notice that they're having diminished sensitivity in some areas, which is a sign of Cauda equina syndrome. So it really requires a very invasive and detailed medical examination. Unfortunately, what frequently happens is when a patient is coming in with early stage Cauda equina syndrome, before things have gotten to the point of no return, they get seen at a hospital or another medical facility, and some of these symptoms that aren't obvious get missed. And precious time goes by, and because the patient was just seen and was sent home and told it's probably just arthritis or another condition or just a backache, time goes by, the patient doesn't follow up. They think I was just seen at a facility, I should be fine. And 2-3 days go by, and now the patient's past the point of no return. And it's all because the initial provider, missed those subtle symptoms that are so important to see and so important to make note of in a patient who's suspicious for Cauda equina syndrome. If there's anything that I've taken away from doing these kind of cases is that it's so hard for the patient when they've been a victim like this, because they know that they went to a medical facility, they trusted those doctors or those medical providers to take care of them, and they just didn't receive the care that they needed. And as a result, their quality of life, their ability to be mobile, to not live in a wheelchair, use a walker, their ability to use the bathroom with dignity has been taken from them. If you've been affected by medical malpractice, or you have Cauda equina syndrome and now you're dealing with the consequences, which are devastating, feel free to contact our office. We've handled cases involving Cauda equina syndrome and similar conditions before. We'd be happy to speak with you and see if we can help.